What I'm about to share is going to change how you think about controlling your blood sugar at night. And when I show you bedtime drink number one, the one supported by clinical research, you may start to wonder why such a simple strategy isn't talked about more often. Right now, someone with diabetes is going to bed feeling confident. Their evening reading looked fine. They avoided desserts. They followed their routine. Everything seems under control. But while they sleep, their blood sugar slowly rises. By morning, their fasting number is higher than expected, and they don't understand why. This happens more often than people think. You wake up to 170. Someone else wakes up to 165. Another person sees 180 and feels frustrated, wondering what went wrong. They did everything right during the day, yet their morning reading tells a different story. But here's what many people don't realize. The hours you sleep are when your body is supposed to stabilize blood sugar naturally. This is when insulin sensitivity can improve and when your liver should slow down glucose release. For many people, though, that balance never happens. By the end of this video, you'll know 3 bedtime drinks that can help support better overnight glucose control. And more importantly, you'll understand why drink number 1 is so powerful that, in clinical studies, it lowered fasting blood sugar by an average of about 30 milligrams per deciliter. That's a meaningful change, especially for those struggling with high morning readings. But before we get to that, you need to understand what's really happening to your blood sugar while you sleep. Let me explain what's actually happening during the night, because this is where most people get confused. You go to bed thinking your blood sugar is stable. Maybe your evening reading was 135 or 140. Nothing alarming. You feel reassured that everything is under control. But your body doesn't stop working when you fall asleep. In fact, one of the most important things that happens overnight is that your liver continues to release glucose into your bloodstream. This is completely normal. Your body does this to make sure you have enough energy while you sleep. In people without diabetes, insulin keeps this process balanced. Blood sugar stays steady, and sometimes it even dips slightly during the night. But in people with diabetes or insulin resistance, that balance doesn't work properly. The liver releases more glucose than necessary, and the body doesn't respond efficiently with insulin. As a result, blood sugar begins to climb while you sleep. Then, in the early morning hours, something else happens. Around 4 to 6 a.m., your body releases hormones like cortisol and growth hormone. These hormones help prepare your body to wake up, but they also make your cells more resistant to insulin. So now you have 2 things happening at once. Your liver releasing more glucose and your body becoming less responsive to insulin. This combination is what many people experience as high fasting blood sugar. You didn't eat anything overnight, yet your glucose is higher in the morning than it was before bed. It feels confusing, but physiologically it makes sense. This is why nighttime strategies matter so much. If you can support your body during these critical hours, you can help reduce that overnight rise. And this is exactly where the right bedtime drink can make a meaningful difference. Let me tell you about David, because his situation is something many people with diabetes will recognize. David was 62 and careful with his meals. His evening blood sugar was usually around 140, nothing alarming. But every morning, his fasting glucose was high, often between 165 and 175. He wasn't eating late or snacking, yet his numbers kept rising, which left him frustrated. The problem wasn't his daytime routine. Overnight, his liver was releasing extra glucose, and his body wasn't responding efficiently with insulin. By morning, his blood sugar had already climbed. Once he understood this, he began focusing on his bedtime routine, where small changes can make a meaningful difference. This is why what you do before bed matters. During sleep, your body should stabilize blood sugar, but stress hormones, low insulin sensitivity, and poor sleep can cause glucose to rise overnight. A simple bedtime habit can help. The right drink supports relaxation, improves insulin response, and reduces liver glucose release. These drinks aren't just hydration. They influence your most important hours for glucose control. Now, let me show you bedtime drink number 3. Bedtime drink number 3 is something many people already use for relaxation, but few realize it can also support better blood sugar control. Bedtime drink number 3 is chamomile tea. This gentle herbal tea works in a slightly indirect way, but the effect can still be meaningful. Chamomile helps promote relaxation and improve sleep quality. And better sleep plays a larger role in blood sugar control than most people realize. Let me tell you about Carol, 68 years old. She had fairly stable blood sugar during the day, but her fasting readings were consistently high. Her evening numbers looked acceptable, often around 135. Yet every morning she woke up between 160 and 170. She couldn't explain it. When she described her routine, one detail stood out. She wasn't sleeping well. She woke up several times during the night, sometimes feeling restless, sometimes anxious. By morning, she felt tired before her day even started. Here's why that matters. Poor sleep increases stress hormones like cortisol. These hormones signal your liver to release more glucose into the bloodstream. At the same time, they reduce insulin sensitivity. Together, these changes push blood sugar higher overnight. Chamomile tea helps break this cycle. It promotes relaxation, supports deeper sleep, and reduces nighttime stress. Research has also shown that regular chamomile consumption can improve fasting blood sugar and overall glucose control in people with type 2 diabetes. Carol began drinking 1 cup of chamomile tea about 30 minutes before bed. Within a week, she noticed she was falling asleep faster. Within a few weeks, she was waking up less often. Gradually, her fasting blood sugar began to improve. Her morning readings dropped from the mid-160s to the mid-140s. This is why chamomile tea earns the number 3 spot. It doesn't directly force blood sugar down, but by improving sleep and reducing stress hormones, it creates the conditions for better overnight glucose control. To use it effectively, drink 1 cup of chamomile tea about 30 to 45 minutes before bedtime. Avoid adding sugar or honey. Consistency is important because the benefits build over time. But as helpful as chamomile tea is, there are 2 drinks that have even stronger effects on overnight blood sugar. Let me show you bedtime drink number 2. Bedtime drink number 2 works more directly on blood sugar, and the research behind it is stronger. This is one of the few simple strategies that has been studied specifically for its effect on fasting glucose. Bedtime drink number 2 is apple cider vinegar diluted in water. It sounds simple, but this combination can influence how your body handles glucose overnight. Apple cider vinegar has been shown to improve insulin sensitivity and reduce the amount of glucose released by the liver. These are exactly the 2 processes that contribute to high fasting blood sugar. Let me tell you about Mark, 65 years old. His daytime blood sugar readings were fairly controlled, usually around 145. But every morning, he woke up to numbers in the 170s. He was frustrated because he followed his diet carefully and avoided late-night snacks. The pattern never changed. Evening reading looked fine. He went to bed. By morning, his glucose had climbed again. When he started using apple cider vinegar before bed, the change was gradual but noticeable. He mixed 1 tablespoon in a full glass of water and drank it about 30 minutes before sleeping. After about 2 weeks, his fasting readings began to shift. Instead of 175, he saw numbers around 160. Over time, the improvement became more consistent. Clinical research helps explain this. In one study, people with insulin resistance who consumed vinegar at bedtime experienced a reduction in waking glucose levels by about 4 to 6%. That may seem modest, but for someone waking up at 180, even a small reduction can move them closer to a safer range. Apple cider vinegar works by improving how your body responds to insulin and by reducing overnight glucose production from the liver. Taken before bed, it supports your metabolism during the exact hours when blood sugar tends to rise. To use it properly, mix 1 tablespoon of apple cider vinegar in a glass of water and drink it about 30 minutes before bedtime. Never drink it undiluted and avoid adding sugar. Consistency is key to seeing gradual improvements. But even though apple cider vinegar is effective, it still doesn't match the impact of bedtime drink number 1. Because drink number 1 has clinical evidence showing a larger reduction in fasting blood sugar. Before I show you bedtime drink number 1, let's put this into perspective. Chamomile tea helps by improving sleep and lowering stress hormones, while apple cider vinegar works more directly by improving insulin sensitivity and reducing liver glucose release. Both support better overnight blood sugar control. But drink number 1 targets insulin resistance more directly. When insulin sensitivity improves, your cells absorb glucose more efficiently while you sleep. This drink is simple, inexpensive, and already in most kitchens. In clinical studies, it lowered fasting blood sugar by about 30 milligrams per deciliter. That's a meaningful reduction. Now let me show you bedtime drink number 1. Bedtime drink number 1 is cinnamon mixed in warm water. Yes, cinnamon. Something simple, inexpensive, and already sitting in most kitchens. But when used consistently, it can have a meaningful effect on overnight blood sugar. Let me tell you about Karen, 60 years old. She had been living with type 2 diabetes for several years. Her daytime readings were fairly stable, usually around 145, but her fasting blood sugar was always higher. Most mornings, she woke up between 165 and 175. She followed her diet, avoided late-night snacks, and stayed active, yet her morning numbers didn't improve. When she began using cinnamon before bed, she mixed half a teaspoon of Ceylon cinnamon into a cup of warm water and drank it about 30 minutes before sleeping. She didn't change anything else in her routine. After a couple of weeks, she noticed her morning readings were slightly lower. Instead of 170, she started seeing numbers closer to 155. Over time, her fasting glucose continued to stabilize. Cinnamon works by improving insulin sensitivity. When your cells respond better to insulin, glucose moves out of your bloodstream more efficiently. Cinnamon also helps slow carbohydrate breakdown and supports more stable glucose levels overnight. Clinical studies have shown that cinnamon supplementation in people with type 2 diabetes lowered fasting blood sugar by an average of about 30 milligrams per deciliter. That's a meaningful reduction, especially for those struggling with consistently high morning readings. To use it effectively, mix about half a teaspoon of Ceylon cinnamon into a cup of warm water. Drink it 30 minutes before bedtime. Avoid adding sugar and stay consistent. Cinnamon works gradually, improving insulin sensitivity over time rather than producing an immediate drop. This is why cinnamon earns the number 1 spot. It directly targets insulin resistance, supports overnight glucose control, and has research-backed evidence showing measurable improvements in fasting blood sugar. At this point, many people wonder whether they should use all 3 drinks together. Since each one works differently, combining them might seem like a faster solution. You can combine them, but it's best to do it strategically. Drinking all 3 right before bed isn't ideal, because too much liquid may disturb your sleep, and poor sleep can raise blood sugar overnight. A better approach is to space them out. For example, you could take apple cider vinegar earlier in the evening, then choose either chamomile tea for sleep or cinnamon water for insulin sensitivity closer to bedtime. Another option is to rotate them on different nights, which keeps things simple and helps you see how your body responds. Consistency matters most. These drinks work gradually, not instantly. Try one approach for 2 to 3 weeks and monitor your fasting blood sugar for steady improvement. To recap, chamomile tea supports sleep and lowers stress hormones. Apple cider vinegar improves insulin sensitivity and reduces liver glucose release. Cinnamon targets insulin resistance more directly and has been shown to lower fasting blood sugar by about 30 milligrams per deciliter. Each drink works differently, but used consistently, any of them can support better overnight glucose control. To get the most benefit, combine these drinks with a simple bedtime routine. Finish dinner 2 to 3 hours before bed and consider a short walk to improve insulin sensitivity. About 30 to 45 minutes before sleep, choose one drink based on your goal: chamomile for better sleep, apple cider vinegar for high fasting sugar, or cinnamon for insulin sensitivity. Afterward, keep the environment calm by avoiding screens and stress. Light reading or gentle stretching can help your body relax. When done consistently, this routine reduces stress hormones, supports insulin response, and helps stabilize blood sugar overnight, leading to steadier morning readings. The key idea is simple. What you do before bed influences your blood sugar overnight. Choose one drink and use it consistently for 2 to 3 weeks while monitoring your fasting readings. Improvements may be gradual, so stay consistent. If one option doesn't help, try another. These drinks support your routine, not replace medical advice. If this helped, write relief in the comments. Share with someone who needs it. I'll see you in the next video.